Welcome back to Champion News Talk Radio. We are with C. Stephen Tucker. Solutions, Steve.
Yes,
Quick.
we mentioned tort reform
Yep.
must be implemented. We mentioned repealing the McCarran-Ferguson Act, so health insurance can be sold across all state lines. Number three, we have to make sure that we get rid of the World War II era tax favorability for group health insurance. All of them should have the same tax benefits, whether you buy individual health insurance or you buy group health insurance through your employer.
Okay.
So that there are incentives for people to purchase health insurance besides the IRS coming after them with a minimal fine.
Okay.
Then we also have to implement consumer-driven tax-qualified health insurance plans, not just on a personal level, like I discussed, John Mackey did.
Consumer-driven, and this is one we talked about, a business medical saving account.
Health savings account. And not just personal plans. I'm talking about Medicaid. What we just did in Illinois is we had 11 rhino Republicans and we had 4 lame duck senators implement Obamacare early, okay? And instead of listening to what Governor Mitch Daniels did in Indiana when he reformed Medicare without taking a dime, not a penny from the U.S. Treasury, by implementing health savings accounts, which falls under the umbrella of consumer-driven tax-qualified health insurance. And now those Medicaid recipients, they have an idea of what health care costs. What we did in Illinois when we passed SB 2840 and HB 5007, aka Medicaid reform, is that we decided that cost sharing means implementing a $3.60 copay for your doctor visits. I would kill or die for a $3.60 copay.
Yeah, right.
Right? They also said, because remember, Tom Cross said, well, we only did this in Cook County. We only did this in Cook County. Read SB 2840, read HB 5007. You can read them at cstephentucker.wordpress.com. We have now said that hospitals all over Illinois, if you qualify for income levels above 200% above the federal poverty level, your biggest responsibility in any inpatient or outpatient setting is $300. The rest will be paid for by the few, the proud, the 53% of us who pay income taxes.
Well,
Doesn't
you know what?
sound
We're going to
reasonable
bring
to it
you
at all.
Nope.
Let me bring something else into this, and that is our wonderful single-payer system for education,
Yep.
which stinks on any international level. But just to show you how the rotten operating things come into our single-payer system, bureaucratic-run school system. I've got the salaries here in Illinois for various things. Here's automotive repair teacher. Top one is $175,000 plus. There's 24 of those in the state. Take drama. The top one is $180,000. There's 30 of those. It goes on down. Librarians. That's $156,000. This is salary per year.
This isn't even pension and other benefits?
The pension and benefits will be similar and a little bit above and growing.
Yeah.
You know, a librarian that runs a township library, which is more like running a business with all the things and hiring and firing and books and decisions and handling the public, they would make something in the 90s managing it. So there's $156,000 for the top one. There's 53 of those in the state of Illinois. This is what happens when you get into a crazy government-run system. There's all kinds. I'm not blaming the teachers. I'm blaming the teachers' union that's running this thing as a single-payer thing.
And that comes from Bill Zettler's great book, Illinois Pension Scam. Mr. Tucker, thank you for joining us. I know you're going to be someplace this afternoon.
Sunday.
So listeners, go visit C. Stephen Tucker and Congressman Joe Walsh for a healthcare town hall at the Belvedere Banquet Hall, and that's in Elk Grove Village. And be sure to catch us here next Sunday.
When is that going to be?
Today. It's going to be today from 3 o'clock to 5 o'clock. But we will see you here next Sunday at 8 a.m. on AM 560 WIND. This is Champion News Talk Radio, your choice for the conservative voice. Make it a great week.